What are the other ways that I can increase my testosterone? If I go and get tested and it says that I have low testosterone levels and I don't want to just inject myself with testosterone, are there natural ways that I can increase it?
Absolutely. So number one is sleep. So sleep is really, really important for testosterone. We know that when you reduce the amount of sleep you have, so for example, you sleep less than 5 or 6 hours, you're going to have at least 10 to 15% reduction in testosterone. And so because our body follows a circadian rhythm. And so when your testosterone is highest is in the morning and it starts to decline over the course of the day. There's a little bit of a bump again, and then it goes back down. At nighttime, it's low. And your body, when it's sleeping, replenishes that testosterone. And so if you're getting either less number of hours of sleep or poor quality sleep, meaning you're not feeling very rested when you wake up, that's a sign of poor quality sleep. Both of those things can dramatically affect your testosterone. The other thing that you can do is exercise, and specifically resistance exercise. So doing the largest muscle groups, so usually the lower extremities, and using those have been shown to boost testosterone more significantly than any other type of exercise. In fact, when you do high intensity cardiovascular endurance training, so say you're doing Ultramans, marathons all the time, long bike rides, long swimming, swimming for long periods of time, that can actually increase your cortisol, your stress, because your body's having a stress response, and that can actually reduce your testosterone. So it's important to do cardiovascular exercise, aerobic exercise, but in moderation, because we do see some people who are great athletes who, run miles and miles and miles, but their testosterone is low because they've been doing this chronic long duration endurance exercise.
So sort of HIIT training is fine, but it's when you start doing these big Ironman 1,000-mile run things like the cortisol suppresses
and
testosterone.
that's not a large percentage of people, right? But it's certainly, it's like, I'm so healthy, I'm the healthiest I could ever be, and I'm having low testosterone. Why is that?
And what about food and testosterone?
So food, there is a lot of data on food. But the most data is on the Mediterranean diet. And that's because that's the most well studied in medicine. But essentially having vegetables, fruit, low amounts of processed foods, good healthy fats, nuts and seeds. So a lot of people don't realize, but you need good fat to have testosterone. Testosterone is in the cholesterol pathways. And so it comes from those pathways. And so you need to have some level of fat. If you have too low fat of a diet, that'll also affect your testosterone. So ideally, what I tell people is, while there's lots of data on different types of diets, the important thing to know is you want to avoid processed foods, avoid a lot of sugar, and have good healthy fats in your diet.
What about, I've heard a few times that testosterone levels have been declining over the last couple of decades in men. Mm-hmm. Is this true?
Yes, it is true. So we're not only seeing a decline in testosterone levels, but we're seeing a decline in sperm quality and sperm numbers. So the concentration of sperm, and over the course of the last 50 years. And there's a lot of reasons for that. One is that, society has become more sedentary. We're seeing people less active, getting more and more metabolic conditions like diabetes, high blood pressure. These conditions then cause endocrinologic abnormalities. They cause problems with blood flow, and all these things can affect the quality of your sperm as well as the quality of your testosterone production. And then also there's more, we think in the environments we know, there's more microplastics and more endocrine disrupting chemicals, right, in the environment. So that is probably playing a role. Now, we don't have exact quantitative data on that, but we think that is probably playing a role and reducing the exposure to these endocrine disrupting chemicals. So we tell people, try not to drink out of plastic water bottles, try to warm up food in glass and avoid plastic. I mean, these are easy things you can do, but if you want to stress about the amount of plastics in the environment, there's not much you can do on an individual level. So I tell people, do the things you can control, and the other things sort of, we have to work on as a society.
That's really interesting, because I don't think I think about this much, but removing chemicals from my life in terms of these kinds of things. Mm-hmm. I'm holding the metal mug in front of me, and then the plastic bottles I drink from could be having an impact on my testosterone and my sperm count.
It could. I mean, like, it's not everybody, right? Think about how many people drink from plastic water bottles, but if you can decrease your exposure, right, it's probably additive. So the more exposure you have, the more likely it is to impact your body.
How do they know this? Like, how does anybody know that chemicals are having an impact on our sperm and testosterone?
So there's basic science research where they're looking at the impact of these things on rats and other animals. And then also they're looking on the amount of exposure to things like phthalates in labs and seeing how that, it's all correlation. We can't say it's causative because we're not going to do a randomized study where you drink from water bottles for 10 years and you drink from glass water bottles for 10 years and let's see what happens, right? That hasn't been done. But they can say, okay, the more your exposure based on whatever biomarker we can assess, so maybe urinary phthalates or other things, we can say that, okay, these people who have more exposure to this are more likely, based on the data, to have lower levels of testosterone. And then, looking at the mechanisms of how they interact with the production of testosterone. And I'm not an expert in those areas, but certainly there has been sort of plausible mechanisms of how these things work.
How has sperm count been decreasing over the years?
So if you look at the last 50 years, you'll see that the average sperm count has declined almost 50%. And luckily, the average sperm count is still high enough for fertility rates. The average sperm count is probably around 50 million of fathers, people who father children. And so it's still above that, but it's certainly significantly lower than it was 50 years ago. And so that's where we're thinking, it's probably more of a global environmental factor that's contributing to that, in addition to this increase in comorbidities and poor health over time.
I mean, the direction of travel there is deeply concerning. Because if something declines 50% in the last, 50 years, did you say? Then if we go forward another 50 years and we assume the same rate of decline, that means we'll be at 25% of where we were 100 years ago.
Yeah. And then what if you can't father children anymore? And what if you can't have offspring that will then propagate the species, right? So there's certainly concerns there. And I think, we have to, as a society, do better in terms of the things that we can. So we can control diet, we can control exercise, we can control those things. There's certain things that we can't, but we can try to control what our people are exposed to, and that can be on a governmental level, right? Like having sort of laws in place. So we know in the US there's less restrictions, whereas in other countries there's more restrictions on things like food coloring and dyes that may have, again, I don't know the specifics, but there's certainly more restrictions in other countries than in the US for some reason. And so maybe there needs to be a more critical evaluation of where we can actually put in place some things that would actually have more widespread changes.
When we think about sperm count, we often think about fertility. And, I don't know whether this is just because society has changed and we're trying to have kids later, but it does seem that people are struggling more and more with fertility. I mean, even in my own sort of circle of friends, there's a couple people that have reported to be struggling with fertility, or that, they're spending 12 months or 24 months trying to have children. Do you think this is linked to this as well?
It could be. I mean, when we look at fertility, we know that about half of fertility is due to women, half of fertility is due to men, and then some combination of the two, right? So definitely as women age, fertility goes down, and we know women are waiting longer to have children. So that's a big part of it, that society has changed. Women are working and prioritizing their careers. It's not a bad thing, but it certainly will affect fertility. And then, there may be these issues that are affecting male sperm counts that are also causing issues. But I don't know if there's been any updated data in terms of what are the causes or the numbers in terms of fertility rates.
Fertility aside, is there any correlation between our health outcomes and our sperm volume?
Not volume, but concentration. So volume is the amount of
okay.
Right? So concentration of sperm in the semen is more of a predictor in terms of sperm volume, not semen volume. Let's be clear.
Okay.
So sperm volume, sperm concentration are sort of the biomarkers. And we would say that, yes, there is a correlation with overall health in terms of sperm concentration and sperm volume. But I think I don't want to make people worried that if they truly have a male factor infertility, then now their overall health is a problem. But it's certainly important to be evaluated and seen by your doctor regularly.
And on that point of semen volume, is there a way to increase that? And is it similar to what you said about increasing testosterone, or is there another set of sort of practices we can do to increase our semen volume?
Yeah, so semen volume is variable depending on, the biggest one is how long has it been since you last ejaculated, right? So the longer you delay between one ejaculation to the other, the more semen volume you will get. That's probably the most predictive. Hydration can play a role. So if you hydrate more, certainly you may see more semen volume. Sometimes it's a low semen volume because you're actually having less force of ejaculation. So interestingly, when you're young, the force of ejaculate can be really, really strong. It can be up to 30 to 60 centimeters away. Like when you ejaculate, that's how forceful it can be. As you age, after about 50, it can decline to 15 to 30 centimeters away. And so that can feel like you're having less volume because it's less forceful. And so in those cases, that's because of the pelvic floor muscles that are around the urethra, those muscles there that help sort of propel the ejaculate out. And so you can strengthen those muscles with, again, pelvic floor exercises like Kegel exercises. I caution people because people are always like, these Kegel exercises are great. They're going to increase orgasm. They're going to make my semen propel further. And I think that's fine if you're not having pain, you're not having discomfort, and you're doing them correctly. Because sometimes what we see is it can actually cause harm if your pelvic floor is tense, like we talked about earlier, or it can cause pain and dysfunction if you're tensing, and not relaxing. And so if you don't know how to do them correctly, then you could actually harm yourself. But yes, they can improve semen volume by the parameter of increasing the force of ejaculate and getting more ejaculate out that may be left over if you're not having as forceful of a muscular contraction.